Do this with me right now. Take one slow breath in through your nose. Hold it for just a second. And now breathe out through your mouth. Did you feel it? That drag at the back of your throat? That coating that sits there no matter how many times you try to clear it. Now I want you to answer something in the comments right now before we go any further. When you wake up in the morning, is that throat feeling the very first thing you notice before you have even said a single word? Yes or no? Your answer tells me more about what is driving this than most people realize. Write it below. I read every one. Here's what I need you to understand before anything else. That mucus is not a random annoyance. Your body is not broken. It is doing exactly what it is designed to do. The question that nobody is answering for you is this: what is it responding to? I am Dr. Emily Carter. I work with adults navigating the parts of their health that the standard 15-minute appointment does not have time to reach. And persistent throat mucus is at the top of that list because I have watched people carry this symptom for years, hand it to doctors who shrug, and walk away with nothing but a box of lozenges and a reminder to drink more water. Today, that changes. I am going to walk you through the real causes, and I am going to tell you something that most content on this topic completely skips. There is one root mechanism almost nobody talks about that quietly makes every other cause worse. We are getting to that. Stay with me. The first thing I need to correct is the story you have probably been telling yourself. You have likely been calling this a mucus problem. It is not. Mucus is not your enemy. Your body produces it constantly, every hour of every day, on purpose. It is protective coating. It traps bacteria and particles before they can settle into your lungs. Without it, your airways would dry out and crack open to everything around you. The actual problem is a system called mucociliary clearance. Your airways are lined with tiny hair-like structures called cilia. Their entire job is to sweep mucus upward and outward continuously, like millions of microscopic brooms working in one direction. When you are younger, this system is fast. Mucus clears almost as fast as it forms. Here is what changes. Research has confirmed clearly that these cilia slow with age. They sweep less frequently. Mucus that cleared in seconds at 40 can pool and thicken for hours at 65. This means your body's tolerance for anything that pushes mucus production higher is dramatically lower than it used to be. A small trigger now creates a large problem. Understanding this changes everything about how you read your own symptoms. Now here is the cause that surprises people the most, because it comes from a place they never think to look. When something travels from your stomach into your throat at night, silently, while you sleep, with zero burning, zero chest pain, and zero obvious warning, your throat tissue responds the only way it knows how. It floods the area with protective mucus. Over and over, all night long. And you wake up every single morning feeling like you are swimming through it. This is called laryngopharyngeal reflux, the silent version. Research in ENT literature shows that up to half of people living with this condition never experience classic heartburn at all. Just the throat, just the morning heaviness, just the voice that sounds rough before your first cup of coffee. Ask yourself honestly, is your throat noticeably worse when you first wake up than it is by mid-afternoon? Does it worsen after a large evening meal? These are the fingerprints of something happening while you sleep that you cannot feel, but your throat absolutely can. I am going to give you specific steps for this. Keep watching. Here is the part of this conversation I do not want you to miss. That silent reflux we just discussed and the next cause I am about to explain do not simply exist side by side in your body. They amplify each other. When both are present, and they very commonly are, the result is significantly worse than either one alone. This is the combination almost no one talks about, and it is the combination most likely sitting in your body right now. The second cause is chronic, low-grade sinus inflammation. Not a dramatic infection, not the kind that announces itself with pressure and fever, just mild, persistent swelling inside the sinus cavities that sends a thin, steady stream of mucus draining down the back of your throat all day, quietly, without drama. A 2024 study confirmed the average age of presentation for this pattern is exactly the age group watching this video. And here is why it interacts so badly with silent reflux. Reflux irritates the throat tissue and makes it hypersensitive. Sinus drainage then hits that already irritated tissue, and the response is amplified. More mucus, more throat clearing, more of the cycle feeding itself. If you are finding this helpful, drop the word clarity in the comments right now. I want to know you are here. The third cause is one I bring up gently because it involves something your doctor prescribed for a very good reason. A class of blood pressure medications called ACE inhibitors, used by millions of adults, carries a well-documented side effect. It allows a substance called bradykinin to accumulate in the body, which, in a significant percentage of users, triggers persistent throat irritation and the urge to clear constantly. Studies show adults over 65 have a 53% higher likelihood of experiencing this effect compared to younger users. Here is why it goes undetected. The side effect can develop 6 to 8 months after starting the medication. By then, the prescription and the symptom feel completely unrelated. If you take a blood pressure medication and you are unsure whether it belongs to this class, your pharmacist can tell you in under a minute. And if it does, there are alternative classes that manage blood pressure just as effectively without this mechanism. That conversation with your prescribing doctor is worth having. Here's what I want you to do tonight. Not next week, tonight. Stop eating at least 3 hours before you lie down. When you eat and immediately recline, your stomach is still processing, and the valve that keeps acid contained has its hardest time staying closed. 3 hours of upright time after your last meal is one of the most evidence-supported behavioral changes for reducing nighttime silent reflux. Before you sleep, drink a full glass of warm water. This supports overnight hydration and keeps your mucus thinner so the morning accumulation has less material to work with. Tomorrow morning, before coffee, before anything, drink 1 to 2 glasses of plain, warm water. This one habit, consistently applied, is one of the most commonly reported changes that people say shifted their mornings within the first week. If you want to address the sinus component, a nasal saline rinse once daily for 2 consistent weeks is what clinical reviews consistently support. Not one day, not every few days, daily. Consistency is what separates the people who say it worked from the people who say it did not. And if you take a blood pressure medication, simply ask your pharmacist what class it belongs to. That is one question that costs you nothing. You have been living with this symptom as though it were just part of the landscape. It is not. It has a mechanism. It has causes that connect to each other in specific ways, and it has responses that are practical, accessible, and do not require a specialist to begin. If someone you care about has been quietly clearing their throat through every conversation, every meal, every morning, will you share this with them today? That one share costs you nothing and might be the thing that finally gives them an answer. I am Dr. Emily Carter. Subscribe and turn on notifications because my next video is going to cover the gut connection to chronic throat symptoms, and it is going to change the way you think about where inflammation actually starts. Tell me in the comments, How long have you been dealing with this? I want to know your story. Medical disclaimer. This content is for educational and informational purposes only and does not constitute medical advice, diagnosis, or treatment. Always consult your qualified healthcare provider before making changes to your health regimen.